Welcome to the new video of NDD. Today we will see vitamin C, D, E, K deficiencies and management. So vitamin C or ascorbic acid, it's a water soluble vitamin and we humans cannot synthesize vitamin C ourselves, so it must be obtained through our diet. The deficiency disorder is scurvy and the symptoms are severe joint and muscle pain. It is due to the weakened connective tissue. Then comes anemia. It can develop because vitamin C helps with iron absorption. Next is corkscrew hair. So this is the diagram. It is usually seen in body hairs. Here the shaft of the body hair may become twisted or bent sometimes, associated with pinpoint bleeding spots. So here in this picture, when you closely observe, you can see the bleeding points. Next symptom is petechia and purpura, means small red or purple spots on the skin. It's due to bleeding under the skin. Then severe gum disease or periodontitis. It is the condition where teeth may loosen and eventually fall down. Last symptom is internal bleeding, usually seen in advanced stages where the hemorrhages can occur in various organs and tissues, which can be life-threatening. For moderate to severe deficiencies, dietary changes alone might not be enough, so vitamin C supplements are often prescribed. The typical regimen includes, for mild deficiency, 100 to 200 mg per day orally for few weeks. Then follow-up dosage is 60 to 90 mg per day. When severe deficiency comes, the initial dose will be 1000 mg per day, then 500 mg per day after few months, then this will be continued. Along with this, dietary changes are followed, like increase the intake of vitamin C rich food. Some excellent sources includes fruits, citrus fruits like orange, lemon, lime, papaya, kiwi, all those kind of fruits. Then vegetables like bell peppers, broccoli, then spinach, all green leafy vegetables. Then fortified foods like some juices and cereals are fortified with vitamin C. In other side, when vitamin C is excess in body, it may end up in some risk also, like gastrointestinal upset, including diarrhea, nausea, stomach cramps and all. Then kidney stones, that is due to excess oxalate production. When a lot of vitamin C enters the body, it can cause kidney stones also. So regular follow-up is very much necessary in treatment. Then comes vitamin D. Two forms are there, D2 and D3, ergocalciferol and cholecalciferol. Well, it's often called as sunshine vitamin because our body makes it when our skin is exposed to sunlight. And it is very essential for absorbing calcium and keeping our bones strong. But it does a lot more than just that. It supports our immune system, helps muscle work properly, and even plays a role in reducing inflammation. Deficiency in children, it has rickets. The symptoms are delayed growth, bowed legs and skeletal deformities like this. Then dental problems. Dental problems are like delayed tooth formation or increased risk of dental cavities and all. And in adults, it is osteomalacia. And the symptoms, they are prone for bone fractures, especially in hips and wrists. Then severe muscle pain and weakness, particularly again in thighs, hips and shoulders. Next is increased risk of osteoporosis. It is another complication and generally seen in chronic cases. It's a condition characterized by brittle bones, as shown in the picture, that they are prone to fracture because it is brittle, particularly in postmenopausal women and elderly. This is very common. And treatment, first and foremost treatment is exposing to sunlight. Then eat vitamin D rich foods like salmon, tuna, egg yolks, fortified milk and cereals. If it is not sufficient, go for supplements. For mild deficiency, 800 to 2000 international unit per day, and in case of severe deficiencies, 50 1000 international unit per week for a short period is given. Now we will see vitamin E is a fat-soluble antioxidant that plays a crucial role in protecting our body from oxidative stress. It's also essential for immune function, skin health, neurological functions and all. And actually there are 8 forms of vitamin E, but the most biological active form in human is what I have mentioned, alpha tocopherol. Disorders in adults. First common symptom is neuromuscular problems, which include peripheral neuropathy, that means damage to the peripheral nerves that can cause numbness or tingling sensation, weakness in the hands and feet. Next comes ataxia, that means loss of muscle coordination, making it difficult to walk or maintain balance. Then muscle weakness or difficulty with coordination. Another symptom is vision problem. Then another important symptom is immune system impairment. That means which makes the person susceptible for infection. And common disorders seen in infants and children is first hemolytic anemia. That is seen especially in premature babies. It can cause hemolytic anemia where red blood cells are destroyed faster than the body could replace them. Then comes developmental delays, that is growth problems like retinopathy, a serious eye condition. It can impair the vision or leads to blindness in premature babies. Or weakness and poor reflexes, that means muscle weakness or poor reflexes and developmental delays are common here. And the diagnosis is based on blood tests. A plasma alpha tocopherol level test can measure the amount of vitamin E in the blood. So if the level is below 0.5 mg per dl, are typically considered as deficient. When coming to the treatmental aspect of vitamin E, it focuses on correcting the underlying causes and replenishing the body's stores of vitamin, specifically vitamin E supplements. In that, oral supplements, in most cases, it can be treated with oral supplements of alpha tocopherol. The dosage will vary depend on the individual's needs. For mild to moderate deficiencies, daily dose can be what I have mentioned, 400 to 800 international unit. But when high dose supplements in cases of severe deficiencies or genetic disorders, higher doses is compulsory. For example, individuals with A beta lipoproteinemia may require doses of 800 to 1200 international unit per day. Another treatmental aspect is intravenous vitamin E supplementation for people with severe fat metabolism, malabsorption issues, or premature infants with severe deficiency. Then we'll administer IV vitamin E, may be administered to quickly replenish the levels. Another treatmental aspect is treating the underlying cause. For example, treating conditions like celiac disease, Crohn's disease, or pancreatitis can help to improve fat and vitamin absorption. Then comes genetic disorders. For genetic conditions like A beta lipoproteinemia, lifelong vitamin E supplementation is very much necessary. And dietary changes are another line of management. Increasing dietary intake of vitamin E rich food is very important for maintaining health levels of the vitamin. Some examples are nuts and seeds like almonds or hazelnuts. Sunflower seeds are very rich in vitamin E. Then vegetable oils like sunflower oil, then green leafy vegetables like spinach or broccoli contain a good amount of vitamin E. Then fortified cereals, like some breakfast cereals are fortified with vitamin E, providing an additional source. And once these are done, regular monitoring and follow-up should be done for the patient. Now the last vitamin is vitamin K. Two forms are there, and it's a fat-soluble vitamin. Blood clotting and bone health are the main function. Diagnosis is based on various blood tests and liver function tests, and the symptoms include increased risk of bleeding, like easy bruising, or nosebleed and gum bleed, or menorrhagia. And second symptom is bone weakness. That means increased risk of fractures and osteoporosis due to the poor bone mineralization. Then comes treatment. Dietary management is the main step of treatment, where K1 rich food including green leafy vegetables like spinach, broccoli are given, and K2 rich food, example natto, cheese, and animal products like all fermented items like cheese, natto, or any animal products like liver, eggs are given. And for cooking methods, we should use the fats like oil or butter. It can improve the absorption of vitamin K because it's a fat soluble vitamin. Then oral supplementation, for example, phytonadione 5 to 10 mg orally per day for adults, or injectable vitamin K. Uh, for adults, vitamin K1 5 to 10 mg intravenously is given. Newborns, as a prophylactic vitamin K1 supplementation, 1 mg intramuscular is given at birth. Patients on warfarin, doses of 1 to 5 milligram of oral or intravenous vitamin K can be given to reduce INR safely. So warfarin is prescribed generally for both prevention and treatment of blood clots, and it inhibits the vitamin K function. So in case of deficiency symptoms are observing in warfarin taking patients, then supplements are provided. That's only when it is needed. This is the note what I have said about warfarin. So here ends our video. Next video we will see mineral deficiencies and treatment. Thank you.